This Thanksgiving, there'll be a record number of people traveling to see families and friends.
But health officials are warning people about potential health risks. For more, we're joined by Dr. Timothy Quinn of Quinn Healthcare in Ridgeland. Dr. Quinn, thank you for joining us.
Hey, thank you for having me.
What kind of ailments and diseases should people be looking out for this Thanksgiving?
Well, the most important thing that people should be looking out for is upper respiratory tract infections. And we're talking about coronavirus, we're talking about the flu, we're talking about RSV and all the others. But also people need to be aware of their risk factors. I had the most interesting conversation a little earlier with a mom with 2 children, and both children had runny noses and sneezing and coughing. And the mom was telling me I need to hurry up because they need to go home and pack, because they were getting ready to go see grandmama and granddaddy and all the aunts and everybody in a small town in southern Mississippi. They were so excited, and they didn't have time for me to test the children to see what the cold was. She just wanted me to prescribe some antibiotics so they could go. And I said, wait. I said, we need to test these children because they could have the flu. They could have coronavirus, or they could have something else that's very contagious, can be very harmful to the grandparents that were elderly with potentially compromised immune system. We tested the children, and one child had the flu and the other child had coronavirus. So we had to cancel the trip, but it was good because now those grandparents won't be exposed to these infections that could have been very hurtful to them.
Wow.
Yeah, grandparents have something else to be thankful for
Yes,
this
they
Thanksgiving.
do.
You mentioned testing there. Are we past the point where people should do like just a COVID test before traveling, even if they're not showing symptoms or anything like that? Or should we still be aware of such things as that?
Well, right now, the CDC is not recommending just generalized testing of the population prior to traveling as we did early on in the pandemic, which is good, very, very good. But what we want to remember is if we have symptoms, meaning runny nose, itchy throat, even GI symptoms like nausea, vomiting, and irritable stomach, go ahead and get tested, especially if you're getting ready to go visit family members that are elderly or immunocompromised, because what can happen is you can serve as what's called a carrier, where you have coronavirus, other flu, or some other infection, and go and give grandma that big old kiss like we all can't wait to do. And then we expose the elderly population, and they have less of a chance of fighting it off. So we just really need to make sure if we or any of our children have any symptoms, go ahead and visit their medical provider and get tested and make sure that they don't have something that they can take home to the grandparents or the aunts or uncles that can be very dangerous.
Dr. Quinn, once the family is together, everybody's there, what can they do to protect themselves? Are we masking? Are we not masking? What should we do?
That's a good question. It depends on each individual family member's risk factors. Say, for instance, if you have a family member that's, elderly, 80, 90 years old, even 65 or older, and maybe they have some chronic medical conditions, or if they don't, maybe that family member would understand that they're at a higher risk than the other family members. So maybe we won't do all that kissing of the grandkids. Maybe just a little hugging and blow a kiss to them. But at the end of the day, we just have to look at each family member. If somebody has dialysis or chronic lung conditions, they're more vulnerable. They probably want to keep a little bit of distance and go ahead and wear a mask, because you have a lot of people coming into their home from outside homes that could bring in symptoms. And remember, sometimes our children and younger people can have an infection and have so low symptoms or none at all, they can still serve as carriers. So in that case, if it's somebody that's at high risk, elderly or chronic medical conditions, then they probably do want to wear that mask and still practice some of that distancing.
That's good advice. Yeah. Very good advice.
Well, thank you, Dr. Quinn. Hope you have a happy Thanksgiving and a healthy Thanksgiving, and hope we can all do the same.
Hey, thank you. And remember, everybody practice moderation during those Thanksgiving meals.
Oh, shucks. Oh, yes, that's true.
That's right. You had to throw that in, didn't you? I understand, though. You're right. Thank you very much. Next on 12 News.